diseases that typically were seen as important for the military, those that actually stop troops from being able to do their jobs. Those are still important diseases, but diseases that also affect the stability of an area where we project our forces, those kinds of diseases like HIV, like malaria, like tuberculosis, are increasingly seen as war starters. And as a consequence, those diseases are of great military relevance, because the control of those diseases not only protects our forces and others, protects the global community, but also reduces tensions in the world, and that ultimately is the best way to secure national defense. We have a network of laboratories worldwide. We're used to working in austere environments. We're used to working in areas of the world that are a bit dangerous, and that is where a lot of the military infectious diseases actually occur. So a lot of tropical diseases are in areas of the world that are not particularly safe or easy to work in, and we have a lot of experience in doing that. We wish to work in an environment where comprehensive prevention, care, and treatment, and I will speak specifically to our work in HIV, that those services are available to any research participant that may wish to join our study, and to their families, so that the decision to join a research protocol in the Division of Retrovirology, the U.S. Military HIV Research Program, that decision by any given research participant anywhere in the world is always made independent of whether or not they need access to prevention, care, and treatment services. Even though our primary thrust has been on HIV vaccine development, we have always and will always have a comprehensive approach to our HIV prevention, which includes prevention messages, the use of antiretroviral therapy, the exploration of non-vaccine approaches to prevention, and ultimately a vaccine. We know from a number of studies that we've executed over the past 10 years that as a consequence of us performing those initial prevention services, that the rate of HIV disease in the population that we're studying falls consistently over the period of time in which we're doing our studies. The HIV prevention field is one that includes both primary prevention techniques that reduce risk behaviors, that also includes obviously the use of barrier methods like condoms and microbicides. Our program is most heavily focused on the development of a vaccine as the ultimate prevention tool for HIV infection. And lastly, the use of drugs, antiretroviral drugs, to reduce the level of HIV infection in a community, and therefore reduce the amount of transmission, is also a viable option as we go forward. There's been much debate in the field recently about how much relative effort should be spent on any one of these prevention areas. We believe that all of them are important.